Hello, I'm Sarah Marbury, Executive Vice President and Chief Operating Officer at the Center for Health Design. I'm recording this interview with Dr. Ezekiel Emanuel, who is Vice Provost and Chair of the Department of Medical Ethics and Health Policy at the University of Pennsylvania, and also a New York Times contributing columnist. Dr. Emanuel is a former special advisor for health policy to the Director of the White House Office of Management and Budget. He's with me today to talk about his upcoming appearance as the opening keynote speaker at our Healthcare Design Conference in Nashville. Welcome, Dr. Emanuel.
Nice to be with you.
So tell me, what will Healthcare Design Conference attendees learn about healthcare reform in your keynote address?
Well, I'm going to talk about first why we needed healthcare reform, the sort of pressing and crushing cost issues, quality problems, and then I'm going to talk about what's in the Affordable Care Act to sort of give them what I take to be the highlights of it, especially how it's going to change the delivery of care. And then I'm going to end by talking about how I think it opens a door for innovation and innovation in design especially.
And what are some of the things that you feel that healthcare reform, how it will affect the design of healthcare facilities? Give us a little teaser here.
Yeah. First, I think when we talk about innovation in healthcare, everyone immediately gets in their head a picture of a new drug or a new expensive device or maybe a new surgical procedure. But I think we need to think of innovation in a much broader way. We need to think of innovation in terms of different ways of designing hospitals to make them more efficient, to make them safer. We need to think of designing new processes of care, again, to make them more efficient, to reduce problems, to make care better. And so part of what I want to stress, and I do stress a lot, is that innovation means more than just a new drug or a new device, and that design is an essential element of innovation, design in how we build buildings and how we lay out patient care areas. So I'm a big believer in design and the importance of design, and I think we tend to underplay it.
Do you think that healthcare reform will produce more emphasis on clinic-based care, and the days of the big box hospital may be waning?
We're going to continue to have big, high-tech hospitals. We're going to probably have fewer hospitals overall, and I do think we're going to try to. There's going to be a big emphasis on shifting more care to the outpatient setting, shifting more care home for any number of reasons: reducing infections, saving money, comfort of patients. So I absolutely think that's one of the things you can count on in the future.
So what about, the word reform often makes people uncomfortable as it means change. And even if the ultimate goal is to create a better healthcare system, how do we address and ultimately overcome this fear so we can move forward?
I don't think there's any way of overcoming the fear because I think that's sort of biological. People get used to a routine. They have accommodated to a routine, and change inherently makes people nervous because they're going to have to modify the way they go around in the world. So I think that's sort of inherent. I think what we need to keep in our mind's eye very clearly is that the current system is untenable. It's not desirable from any standpoint, whether it's the number of uninsured people, it's the high cost, or it's the uneven quality. And so change ought to be, I think, despite its trepidations, embraced because it is going to get us to a better place in terms of the care. And it also means that we have an opportunity to improve things. So I think whether we're patients or engaged in the healthcare process in some way, whether it's doctors or designers, we can recognize that this is going to give us a great opportunity to actually make the system better. And, from that standpoint, I think we should welcome change.
That's terrific. Well, thanks, Dr. Emanuel. I really look
No
forward
problem.
to hearing. I look forward to hearing your keynote address at the Healthcare Design Conference in Nashville. And for anybody who's listening, if you want more information on the conference, please visit our website at healthdesign.org.